Hi, and thank you for clicking on this video. A Google document has recently been brought to my attention, and I wanted to address some of the information that is presented in this document as fact. If you have seen this document, then you can now accurately investigate what was presented, and if you haven't seen this document, then now you know a few reasons why you should probably avoid it. I hope this video helps someone. Let's dive right in. So this is a Google document. It's Cryptic Pregnancy Symptoms, an in-depth look. I wanted to address this slide in particular because it talks about the unusual growth of the uterus, which states that we can feel fetal movement from our lower back to our shoulder blades. This is very interesting to me, to be able to feel your baby from your lower back up to your shoulder blades, and I'll show you why in this next slide. As you can see, if the baby is inside of the uterus, how is it getting all the way up to the shoulder blades? I mean, that's a very big distance, and unless the baby's not within the uterus and it's growing outside of the uterus. In this next slide, it says, babies even hide behind organs like the liver, lungs, and kidneys. As baby gets bigger, so does the uterus. It begins to grow out front, and if you're lucky, you will get a good picture of baby. So they do admit that the baby is inside of the uterus. So again, I ask, how is the baby growing inside of the uterus, but also kicking you behind your shoulder blades? I don't understand how they're feeling fetal movement between their shoulder blades. This next slide says, but most of the time baby likes to hide, quote unquote, in your back behind the organs and intestines. Most women, not all, will lose their belly and start to round out and harden as baby gets bigger. In this next slide, I'm going to ask, how are these babies inside of the uterus hiding behind the intestines and the organs and not causing the mother major pain and discomfort? This picture represents the size, shape, and location of the uterus before pregnancy. The way the uterus grows during pregnancy is exactly the same for every kind of pregnancy. I wanted to address this slide in particular because it says almost every ache and pain you experience can be contributed to pregnancy. This is a major assumption and a big no-no. It is followed by, as always, if you need to see your doctor just to be sure everything is okay, please do so. What if the woman doesn't feel she needs to go to the doctor because she has this presentation? I wanted to address this slide because it says sometimes we mistake fetal movement for back pain. Most of the time it's caused by baby's position. They have our whole back from the shoulder blades down to the buttocks to swim around in. How are babies swimming around in your buttocks? If they are in fact in the uterus, how are they going from the shoulder blades and swimming down to your buttocks? Let's look at the next slide. If you look at this slide, these are your buttocks. How is the baby swimming from here up to here? I wanted to address this slide in particular because it says babies like to stay in the middle or back due to the way the uterus has grown. I'm very interested to know how different the uterus grows in a cryptic pregnancy. It also goes on to say there is also a risk of your uterus adhering to your abdominal wall if you are pregnant for a few years, as well as to the bladder. And this is a total assumption. Let's take a look at this picture. And if you look here at this clip, you can see that the baby is located in the middle and towards her spine, which would be towards her back. That's exactly how a baby grows, no matter what kind of pregnancy you're having and no matter what kind of uterus you had prior to being pregnant. I wanted to address this slide in particular because it details that although you feel like your heart is going to burst, most likely it's just the baby reminding you they're still there. You should never depend on heart palpitations to confirm your pregnancy. Heart palpitations are a whole thing in itself, and it should never be used to confirm a pregnancy. I wanted to address this slide in particular because it says the reason behind why they'll carry longer than 40 to 42 weeks is because of intrauterine growth restriction, or IUGR. So what is intrauterine growth restriction, and does it apply to cryptic pregnancy? Let's look a little further. Intrauterine growth restriction, also known as fetal growth restriction, is a condition in which a baby's growth slows or stops during pregnancy. Unborn babies with intrauterine growth restriction can grow so slowly in the womb that they are at risk of health problems. This is important to note because it is the slow growth itself that are causing these health problems. If the growth restriction is severe enough, the baby may have to be prematurely delivered. This is important to know because if the baby is not delivered in time, it's at higher risk of fetal death. So I wanted to address this slide because it says, for whatever reason in cryptic pregnancy, our placenta isn't producing the proper amount of HCG, if any. This placental abnormality is a contributor to having intrauterine growth restriction. So if the placenta isn't producing the proper amounts of HCG, does this contribute or affect the development of the condition intrauterine growth restriction? Let's look deeper. So on this slide, it says the majority of cases of IUGR are caused by failure of the placenta, but there are also several other factors that could cause a baby's growth to be restricted. Now, I've personally have done several searches, and not once have I ever found anybody who has said specifically that HCG or failure to produce HCG is the cause of intrauterine growth restriction. I wanted to address this slide in particular because it says that these stalls occur due to lack of nutrition to the fetus and poor uterine growth. Good news is most of these babies are born healthy. I'm very curious to know how lack of nutrition equals healthy. It is also known that intrauterine growth restricted babies are more likely to have health problems near the time of birth and after delivery. So I wanted to address this slide because it says these so-called stalls can last for a day, a week, or even months at a time. During these stalls, our body assumes the fetus is no longer viable, aka dead, and begins the natural absorption process. What is the natural absorption process, and how does that apply to cryptic pregnancy in absorbing a fetus in utero? Let's take a deeper look. What is fetal absorption? A vanishing twin, also known as fetal resorption, is a fetus in a multi-gestational pregnancy which dies in utero and is then partially or completely reabsorbed. It is important to note that in order for fetal absorption to take place, the fetus has to die in utero, meaning the fetus is no longer viable. Now that we're fully aware of what fetal absorption really means, I wanted to address this next slide because it goes on to say, this means a baby that was once measuring 15 weeks can quote unquote shrink to 7 weeks. Once the body realizes the fetus is viable, the natural absorption process stops, the stall ends, and baby starts growing again. So my question is this, how does the fetus then come back to life and then reappear in the uterus to continue growing? Let's take another look at the natural absorption process definition. It says the fetal tissue is absorbed by the other twin, multiple, placenta, or the mother. The definition of absorb is to physically take in, consume, or ingest. How are these cryptic babies being physically absorbed or taken in by the placenta or the mother, but then continuing to grow after the stall discontinues. I also wanted to address this next slide because it goes on to say that the placenta will be absorbed also, and as the baby starts to grow again, so will the placenta. This could potentially correct the placental abnormality, and your pregnancy will quote unquote go normal. So let's take a little more in-depth look at the role of the placenta during pregnancy and if it can actually be absorbed during pregnancy. The placenta and its health are vital to the health of a woman's pregnancy and fetal development. This organ provides oxygen, nutrients, and filters fetal waste during pregnancy. It also protects the fetus from bacteria and infections and plays an important role in hormone production. Because the placenta itself plays such a vital role in the health of the pregnancy and the fetal development, if at any point in time the placenta is compromised, this can directly result in fetal death and ending of the pregnancy. Okay, so I think that's all for this video. I wanted to also note that intrauterine growth restriction and fetal growth restriction have been studied in many, many different settings for decades. We're talking about over 50 years of clinical and medical research done on this specific condition developing. It's a pretty rare condition, but there have been many, many studies done on this. And not once has there been a link to low amounts of HCG or non-existent amounts of HCG being related to the development of intrauterine growth restriction, also known as fetal growth restriction. This is very important to know, to understand when you are investigating a cryptic pregnancy or an extended gestation pregnancy, a pregnancy that has gone past the 42 weeks gestation period. Also, I wanted to make it known that intrauterine growth restriction or fetal growth restriction has never been associated with the absorption of the fetus during the time that the baby is stalled in growing or has stopped growing. There has never been any clinical, nobody's ever clinically or medically observed a baby stopping its growth, becoming partially absorbed by the mother, and then all of a sudden starting to grow again. That has never been clinically observed in the actual condition, intrauterine growth restriction or fetal growth restriction. I wanted to make sure that these things are known, that these things are aware, that this information is out there if you were looking for it. You can pretend like these things are associated with these conditions, but these conditions have been so thoroughly researched and everything about them has been looked at, because these conditions such as intrauterine growth restriction and fetal growth restrictions, these conditions have been known about for many, many years. We're talking about hundreds of years. This is not something that has, recently, a condition that's recently been known or found out about. This is something that healthcare professionals and all kinds of people have gotten their hands on why and how these things happen. So I hope you guys enjoyed this video. If you have any questions, if you have any comments about it, please leave them in the comment section below. If you liked this video, please give it a thumbs up. And I hope you guys enjoyed. I hope you guys got something out of it. I hope I helped somebody in clarifying some things that may not have made sense. I hope you guys are well. I hope you're happy. Thank you guys for watching. Bye.